Hi everybody, this video of mine is about muscle pain and the management of ankle sprain. Almost everyone has sore aching muscles now and then. Muscle pain can involve a small area of your whole body ranging from mild to excruciating. Although most muscle aches and pains go away on their own within a short time, sometimes muscle pain can linger for months. Muscle pain can develop almost anywhere in your body, including your neck, back, legs, and even your hands. Now I'll tell you the causes of muscle pain. The most common causes of muscle pain are tension, stress, overuse, and minor injuries. This type of pain is usually localized, affecting just a few muscles or a small part of your body. Systemic muscle pain, that is pain throughout your whole body, is more often the result of an infection, an illness, or a side effect of a medication. Now I'll tell you some causes of muscle pain. Most common I already told you. There are some diseases which can cause muscle pain. You can note down these illnesses, and I'll try to make videos on these illnesses as well in future, inshallah. Okay, now I'll tell you the common causes of muscle pain. This chronic exertional compartment syndrome, number 1, chronic fatigue syndrome, claudication, dermatomyositis. I'm telling you the names of different diseases. Okay, next come dystonia, then fibromyalgia, hypothyroidism, that is the underactive thyroid gland, influenza and other viral illness, influenza-like illness, lupus, Lyme disease, medication, especially the cholesterol medication known as statins, muscle cramps, myofascial pain syndrome, polymyalgia rheumatica, polymyositis, that is inflammatory disease that causes muscle weakness, repetitive strain injuries, rheumatoid arthritis, that is inflammatory joint disease, Rocky Mountain spotted fever, and sprains. Okay, as I told you just now previously that most common cause of muscle pain are tension, stress, overuse, and minor injuries. The diseases which I have told you just now are also the causes of systemic muscular pain or localized muscular pain. So in this video, I'll discuss the management of ankle sprain, because if I start discussing about all these individual diseases, the video will be very, very long, and I'll try to make videos on these diseases in futures. Okay, now let me tell you when you should see the doctor. Muscle pain from minor injuries, stress, or exercises usually helps with simple home treatment. Muscle pain from severe injuries or systemic disease is often serious and requires medical care. You should get immediate medical care if you have muscle pain with trouble breathing or dizziness, extreme muscle weakness, a high fever, and stiff neck. There are some serious diseases which can also cause muscle pain. For example, the disease, for example, I told you this high fever and stiff neck a symptom. This is due to meningitis, which is a serious illness. Okay. Also, you should go to the doctor if you have a known tick bite or could have had a tick bite, a rash, especially the bullseye rash of Lyme disease, muscle pain, especially in your calves, that occur with exercise and resolve with rest, signs of infection such as redness and swelling around a sore muscle, muscle pain after you start taking or increase the dosage of a medication, particularly statins medication which are used to control cholesterol, and muscle pain that does not improve with self-care. These are the conditions which if you suffer from these problems, then you should arrange a visit to the doctor. Okay. Now I'll tell you the self-care, particularly of ankle sprain or any other sprain which can cause muscle pain. This management is this management which I am going to discuss is particularly for ankle sprain, but these are the general principle And if you have a localized pain in a few group of muscle, then you can apply these principles also. Okay, now let's come to the management. The muscle pain that occurs during activity usually signals a pulled or strained muscle. So I'm going to tell you the pulled muscle management. Okay, these type of injury usually respond well to RICE therapy. RICE is an abbreviation that is RICE, which involves RICE. R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. Okay, this is RICE therapy is particularly effective in the management of ankle sprain and some other sprains. Okay, so what is RICE? Okay, as I told you, R stands for rest. So if you suffer from this sprain, then take a break from your normal activities. Ice. Okay, you should place an ice pack or bag of frozen peas on the sore area for 20 minutes several times a day, usually 4 to 8 times a day. Okay, also C stands for compression. So you can use a compression bandage to reduce swelling due to sprain. Okay, the next come E, which stands for elevation, and that is you have to elevate your foot to help reduce swelling. I mean, if you suffer from ankle sprain, as you can apply this RICE therapy, that is rest, ice, compression, and elevation. Okay, this is a sort of general management of sprain. Okay, as you can see in the picture which I post in these videos, you can see the pictures and you can have you can get an idea how to manage sprains. And also as I told you that the different diseases which cause muscle pain, I'll discuss those diseases individually in my next videos. Okay, so till now, if you have not subscribed to my channel, please subscribe it and click the bell icon so that all upcoming videos from me you'll get notified from YouTube, and it should come to your inbox straight away. And if you think that my videos provide some sort of benefit to you or your family or your friends, you please like this video and share with your relatives and other friends and family members. Also, you can share my videos to different social medias such as Facebook, WhatsApp, Twitter, etc. Okay, thanks for watching my video. See you in next video.